What is depression? Depression is a mood disorder that causes persistent feelings of sadness, emptiness, and loss of joy. It is different from the fluctuations that people regularly experience as a part of life. Major life events such as bereavement or loss of a job can trigger trusted source depression. It can undermine a person's relationships, make worrying and maintaining good health very difficult, and in several cases may lead to suicide. In fact, depression contributes in nearly 40,000 suicides in the United States each year. Depression is the leading cause of disability worldwide according to the WHO, yani the World Health Organization. Conditions that can get worse due to depression include asthma, cardiovascular disease, cancer, diabetes, obesity. Signs and symptoms of depression. Depression can cause a range of psychological and physical symptoms, including trusted sources, persistent depressed disorder, persistent depressed mood, loss of interest and pleasure in hobbies and activities, changes in appetite and body weight, unusually slow or agitated movements, decreased energy or fatigue, difficult sleeping or oversleeping, excessive feelings of guilt or worthlessness, difficulty concerting or making decisions, thoughts of death or suicide attempts. Psychological symptoms of depression. It includes sadness, guilt, anxiety, tearfulness, irritability, drugs, and alcohol abuse. Types of depression. There are several forms of trusted source of depression. Below are some of the most common types: major depression, major depressive disorder with seasonal patterns, postpartum depression, and persistent depressive disorder. Major depression. A person living with major depression experiences a constant state of sadness. They may lose interest in activities they used to enjoy. Persistent depressive disorder, also known as asthma, persistent depressive disorder, causes symptoms that last for at least 2 years. Trusted sources. A person living with this disorder may have episodes of major depression as well as mild symptoms that do not meet the criteria for major depressive disorder. Postpartum depression. After giving birth, some people experience trusted sources for a brief period of sadness or heightened emotions that some people call the baby blues. This usually goes away in a few days to a few weeks. Postpartum depression or personal depression is more severe. Major depressive disorder with seasonal pattern, previously known as seasonal affective disorder. This type of depression usually trusted source occurs during the winter and fall months. When trees is less daylight, less commonly it may follow other such seasonal patterns. It lives during the rest of the years and is response to light therapy. Some other types of depression are known as bipolar disorder, psychotic depression disorder, catatonic depression disorder, and atypical depression disorder. Causes. What can cause depression includes brain chemistry, hormones levels, family history, genetics, sexual interactions. Brain and chemistry. There may be a chemical imbalance in parts of the brain that manage mood, thought, sleep, appetite, and behavior in people who have depression. Hormonal levels. Changes in female hormones estrogen and progesterone during different periods of time, like during the menstrual cycle, postpartum period, premenopause, and menopause, may all rise a person's risk for depression. Family history: you are at a higher risk for developing depression if you have a family history of depression or another mood disorder. Early childhood trauma, brain structure, and medical conditions are also cause of depression. Early childhood trauma: some events affect the way your body reacts of fear and stressful situations. Brain structure: there is a greater risk for depressions if in the frontal lobe of your brain is less active. However, scientists do not know if this happens before or after the onset of depressive symptoms. Medical conditions: certain medical conditions may trust sources put you at trigger higher risk, such as chronic illness, insomnia, chronic pain, Parkinson's disease, stroke, heart attack, and cancers. Substance use also cause depression. A history of substance or alcohol misuse can affect your risk of depression. People who feel emotional or chronic physical pains for long period of time are significantly more likely to trust source to develop depression. Depression causes. Other causes are like stress, poor nutrition, physical health issues. Risk factors for depression may be biochemical, medical, social, genetic, or circumstantial. Common risk factors include sex. The prevalence of major depression in twice is high in females versus sources as in males. It means depression level is higher in females than male. Genetics: you have an increased risk for depression if you have a family history of it. Similarly, like causes of depression. Psychoeconomic status. Socioeconomic status includes financial problems and previous low social status can increase your risk of depression. Substance misuse: about 21% of people who have substance use disorder also experience depression. And medical illness: depression is also associated with other chronic medical illness. People with heart disease or about twice as likely trace those to have depression as people who don't. While up to 1 in 4 people trace those with cancer may also experience depression. Medication: antidepressant can help treatment moderate to severe depression. Several classes of antidepressant are available. Trust sources: selective serotonin reuptake inhibitors SSRI, selective serotonin and norepinephrine reuptake inhibitors SNRI, atypical antidepressant and tricyclic depressant monooxidase inhibitors are also as a medication of depression. Treatment of depressions also includes psychotherapies, medications, and self-help strategies. Therapies of depressions are given as cognitive therapy and behavioral therapy, known as CBT, work well together to treat depression and anxiety disorder. That the two are often combined in an approach called cognitive behavioral therapy. CBT focuses on addressing both the negative thoughts patterns and the behaviors that contribute to depression. Dialectic behavioral therapy. Dialectical behavioral therapy, known as DBT, is similar to CBT but puts a specific emphasis on validation or accepting uncomfortable thoughts, feelings, and behaviors instead of fighting them. Psychodynamic therapy is a form of talk therapy designed to help you better understand and cope with your day to day life. Psychodynamic therapy is based on the idea to shows that your present day's reality is shaped by your unconsciousness childhood experiences.